Some good and maybe even bad news coming out of Washington, D.C. for Medicare Advantage beneficiaries. Stay tuned. So did you know that over half of Medicare beneficiaries are actually enrolled in a Medicare Advantage plan? And this is for several reasons. First, Medicare Advantage plans offer several benefits that actually aren't offered by original Medicare. These include popular benefits such as dental, vision, hearing, and prescription drugs. Because yes, these benefits are not included in original Medicare alone. Also, because many plans offer these additional benefits, they seem to be much less expensive than original Medicare plus a Medicare supplement plan plus Part D plus dental plus vision plus hearing, etc. And not only do these plans offer additional benefits, but very often they do so at no additional charge. So sometimes plans will claim to be free. Now, of course, they're not free. At the very least, you still need to continue to pay for Part B. However, when you look at the fact that you're getting all these additional benefits for no extra cost, it's easy to see why Medicare Advantage plans can be so appealing. Now, a disclaimer here, there are some major trade-offs for these extra benefits, and we will talk about that later in the video. And another reason Medicare Advantage plans are so popular is that brokers often get paid more when you enroll in a Medicare Advantage plan versus original Medicare and a Medicare supplement plan and Part D. And of course, some Medicare Advantage plans pay more than others. Now that being said, a good broker will still point you in the direction of a plan that is best suited to your needs, regardless of their commission. And actually, most people report higher satisfaction with their Medicare supplement plans, also known as Medigap plans, versus their Medicare Advantage plans. And we're going to talk about that in just a bit as well. But if you need help deciding between Medicare Advantage, Medicare supplement plan, if you have questions, you can absolutely reach us in the comments below or at the number on the screen. We are licensed nationwide and there is absolutely no charge for our services. And please make sure to like and subscribe. Okay, back to it. So as I said, in the past, some Medicare Advantage plans might pay larger commissions versus others, and therefore some unscrupulous brokers and agents might point you towards a lesser plan just because it pays them more. However, there will now be a fixed amount, a fixed commission that an agent or broker can earn regardless of which Medicare Advantage plan their client chooses. That being said, there's still a problem because brokers and agents tend to make more money on Medicare Advantage plans versus Medicare supplement plans. And the two are really entirely different. So before you go into your conversation, you should at least have a basic understanding of Medicare Advantage versus Medicare supplement plans. So Medigap plans are also known as Medicare supplement plans, and they actually work with original Medicare to fill in those financial gaps. So if you have original Medicare, you can still have a Medicare supplement plan. However, Medicare Advantage plans are actually a replacement for or alternative to original Medicare. So if you choose to go with a Medicare Advantage plan, you will no longer have original Medicare, although they must offer at least the same benefits. So a Medigap plan will sometimes offer an out-of-pocket max, but that's not even always applicable because, for instance, Plan F is going to cover all of your out-of-pocket costs. With Medicare Advantage, there's always going to be an out-of-pocket maximum. And that really is a major advantage because with original Medicare alone, there is no out-of-pocket maximum, which means if you have major medical bills, then there really is no yearly threshold for your spending. Medigap plans, there may be medical underwriting, depending upon which state you live in and when you enroll. If you enroll in the first 6 months after you turn 65 and enroll in Part B, then there is no medical underwriting. If you do have to undergo medical underwriting, then you could be denied or charged more. Now, there is never any medical underwriting for Medicare Advantage. For Medigap, the plans are offered by private carriers, but they are standardized. So the benefits will remain the same regardless of your carrier. If you pick Plan G, it's going to offer the same benefits no matter who your carrier is. For Medicare Advantage, the benefits really do have quite a wide range, but in general, you will notice that they have lower deductibles, copays, and coinsurance. Medigap plans will not offer additional benefits that aren't already offered by original Medicare. They're really just a financial solution to fill in those financial gaps in the form of helping to pay for copays and deductibles, coinsurance, and possibly imposing an out-of-pocket maximum. Whereas Medicare Advantage plans will offer additional benefits, or very often they'll offer additional benefits, especially things like dental, vision, hearing, and prescription drug. Now, Medigap plans, the good thing about them is that there are no referrals or pre-authorization. So if you need to go see a specialist, you can just go see a specialist, and there's no networks or anything like that to worry about. Now, with a Medicare Advantage plan, regardless of whether you have an HMO or a PPO, there's always the issue of pre-authorization. And of course, if you go with an HMO, then you may need referrals to see a specialist as well. And additionally, they do operate on networks, and those networks can be extremely restrictive. So a Medicare supplement plan won't offer you additional benefits, but it will give you tremendous flexibility, whereas a Medicare Advantage plan will likely restrict your flexibility quite a bit, but it will offer you additional benefits. And some other good changes coming are restrictions on aggressive cold calling and a simplification to the appeals process for those who are denied skilled nursing facility care. Now for the bad. And in all honesty, it might not actually be that bad. It might not even come to fruition. Now, although Medicare Advantage plans are extremely popular, and these private carriers do have a significant corner of the market, rising healthcare costs have possibly led to decreased margins, which means they may be looking to cut corners somewhere. So Medicare Advantage plans must offer at least the same benefits as original Medicare. However, as I mentioned earlier, most of these plans choose to offer additional benefits to entice potential beneficiaries. So these include things like dental, vision, hearing, prescription drugs, but they can include many more benefits as well. Things like transportation, or even discounts, or even a certain amount free at local drugstores. And truly, the list goes on and on. Now, although these plans are not free, no matter what they claim, they very often offer these additional benefits at no extra charge. So for a layman, when you're comparing original Medicare offering a smaller list of benefits versus Medicare Advantage offering a larger list of benefits for seemingly the same cost, it's easy to see why Medicare Advantage can be so popular. But there are major downsides. For example, Medicare Advantage plans operate on networks. With a Medicare Advantage plan, you can choose between an HMO and a PPO. HMOs will only have in-network coverage, whereas PPOs will offer coverage in and out of network. However, it's less expensive if you can stay in-network. For an HMO, a PCP, which is a primary care physician, is required. That's not the case for a PPO. And for an HMO, if you want to go see a specialist, you have to receive a referral from your PCP. And of course, that's not the case with a PPO. However, HMOs usually have lower premiums, and PPOs tend to have slightly higher monthly premiums. And regardless of whether you choose an HMO or a PPO, Medicare Advantage plans are considered managed care plans, which means that even if your doctor orders a specific service or treatment, your carrier, which is your health insurance company, first has to approve that service or treatment. Now, this can cause delays, frustrations, and possibly even denials. But getting back to the latest bad news, or potentially bad news, as I said, because there are changes coming to Medicare Advantage plans, they may be looking to cut corners in the form of cutting back on some of those fringe benefits that make Medicare Advantage plans so incredibly attractive and so very helpful to many Medicare Advantage beneficiaries. So what do you think of these changes? Yay or nay? Let us know in the comments below. And of course, if you have questions, you can reach us in the comments or at the number on the screen. We are licensed nationwide, and there is absolutely no charge for our services. As always, have a wonderful day. Bye-bye. If you want to learn more about Medicare Advantage, make sure to check out this video here. And please make sure to like and subscribe. We'll see you next time.